My name's James Brown. I'm one of the fertility specialists working at Genea Norwest. I wasn't always a doctor. I trained initially as a journalist and worked in different sort of marketing type fields before I then sort of saw the light and went into medicine. And then over the last few years I've been training in obstetrics and gynaecology out at Westmead Hospital, where they have their own fertility centre, which is pretty rare for a public unit. And having that exposure and realising the importance of fertility access as well as quality. I was attracted to fertility because I think it's an under-recognised area where ultimate patient care needs to be undertaken. So often we allocate all our energy and attention to life-threatening conditions and emergencies and all the glamour things that people think about, but I think that fertility has kind of fallen slowly to the wayside and is seen a little bit just as kind of a nice to have or a luxury. But what I've come to learn is it's a necessity for people to build families, and the reason I've chosen this is that I think that there's room to really offer a nice, bespoke, personalised level of care in this particularly stressful but also very happy domain of the specialty that I've trained in. So the reason I've chosen to work with Genea is that I knew about its reputation as one of the best fertility providers even before becoming a doctor. And then as I did my work training through obstetrics and gynaecology, I heard stories from patients about their experiences here, both not just the technology and the success rates, but how they were treated as patients. And that's exactly the way that I would like my patients to be looked after as well. And so I couldn't think of referring anyone anywhere else. Bella Vista, the northwest area, the Hills district, is an area that I've worked in for over a decade, having worked at Westmead Hospital. And the thing that I've learnt the most is that this strikes me as an area where people are building their family and sort of building their wealth and trying to sort of set their family on a good path forward. And often this is first generation immigrants or people who are, jumping up the sort of social ladder and growing what they want to grow. And so being part of an organisation that can facilitate the building of that family it's a real privilege. And this area in particular is an area where I can see that happening most. So the things that I'm interested in outside of work is, golfing, which I know is a bit of a cliched habit, but also spending time with my family, trying to find time with my wife, who's also a doctor as well. But also, one of the other interests I have is economics. So I'm currently, I don't know if I should have done this, but I'm doing a PhD in health economics and doing research looking at sort of risks and things inside of medicine. Why infertility I think is particularly interesting is seeing how challenging it is for some people and seeing how easy it is for others, and recognising the stress for the people that it's hard for. And that's something that I really have to keep in my mind when I'm doing this job. And so pregnancy seems like a natural, somewhat unavoidable event in some times of history, and as we've learnt, that's not the case. And there's a whole group of people who probably suffered in the past and had to just grieve in their own way that they didn't have access to a family. And only recently, in the last few decades, we've had these technologies and services available for us to be able to help people who otherwise couldn't have had help before. So it's nice that we have this, but I also have to recognise that seeing it being easy for others, it must be pretty hard. And so acknowledging that, I'd like to make this journey as easy as possible for the people who see me, and also recognise that this is emotionally stressful, and it's not just about the science and the appointments and everything, but it's how you feel during that process and how you feel at the end of it, and making it positive in both ways.